Hello, welcome to DES Study Portal. Topic for today's session is manual material handling. Manual hazards are there in almost all workplaces. Statistics say that about 1/3 of workplace injuries are caused by manual handling. What is manual handling? It is moving or handling of things manually. It could be any activity like lifting, lowering, pushing, pulling, etc. The risk of manual handling is work-related musculoskeletal disorders, that is MSDs, musculoskeletal disorders, which may cause pain and injury to arms, legs, and joints. High-risk manual handling activities may cause injury to disc, tendon, ligament, muscle, nerves, etc. Does all manual handling activities cause MSD? No. The risk depends on the following factors, that is task, individual, load, and environment. This can be easily remembered by the keyword tile. Now let us see one by one. Task. Task actually indicates how the activity has to be carried out, whether it is lifting or lowering, pushing or pulling. Does the activity involve high force or bending or stretching? Whether the activity is repetitive in nature. Usually, activities which has to be done in awkward postures are considered as high risk category. Similar is the case of repetitive task, especially if the time cycle is 30 seconds or less. So that was the first factor, task, indicated by the letter T. It indicates how the manual handling activity has to be done. So analyze the task, and usually manual handling activities which are repetitive in nature, which involve awkward postures, which involve some high force exertion, etc., normally come to the high risk category. Now going to the second factor, which is the individual. Individual actually indicates who is doing the work. That is the physical capability, age considerations, male-female differences, conditions like pre-existing injuries, physical weaknesses, etc. increase the risk. That means if the task is done by a healthy individual and if the same task is done by a person who has some physical weaknesses or an aged person, then the risk factor is higher than that of the healthier person. Coming to the third factor, that is the load. Load indicates what is to be handled. That is the size, shape, weight of the load. Loads which are large and heavy, or loads which are difficult to grasp, loads which are unstable, loads which are harmful to hold, etc. increases the risk factor. So that was the third factor, load. What is a load that has to be handled, whether it is heavy or light, whether it has sharp edges or not, whether it has handles to hold, whether it is irregular in shape. So consider all these factors. Obviously, loads which are heavy and large are coming under the high risk category. Similar is the case of loads which are harmful to hold, loads which are unstable, they are coming under the high risk category. Now let us see the last factor, that is the environment. Environment indicates where the activity is carried out. That is aspects like condition of the ground, lighting, temperature, effects of the PPE of the person who is doing the manual handling activity, etc. are to be considered. So environment indicates where the activity has to be carried out. If the activity is carried out in a level ground with proper lighting, no effects of temperature and PPE impacts, then it is a considering the environment factor, it is a low risk manual handling activity. So these are the factors which affect the risk of manual handling. This can be remembered by the keyword tile, T for task, I for individual, L for load, and E for the environment. Actually, when you assess a particular manual handling task, usually we split up the activity into these 4 factors, and then it will be easier for us to analyze the risk of the manual handling activity. Now let us see how to manage manual handling hazards in workplaces. In workplaces, there may be a lot of manual handling activities. So how to manage it, or how to control, or how to reduce the risk of manual handling hazards in workplaces? There are 4 steps which can be followed: avoid, assess, reduce, and review. Let us discuss one by one. Avoid. The best way is to avoid manual handling activities involve risk of injury. That is the best way to manage the manual handling hazards. Try to avoid it. How we can avoid manual handling activities? This can be achieved by automation, that is by the use of machines. But there may be limitations in automation in most of the workplaces because the investment is more, and the use of machine, it may also introduce additional hazards. So in many cases, avoiding manual handling activities by automation becomes impractical. In such cases, we can avoid the risk of manual handling activities by simple redesigning. For example, storing heavier and frequently used items in readily accessible locations where it requires least effort in handling. Now, how to redesign? It depends on the workplace conditions and the activities. So, see the activities in your workplace and think of some redesigning so that the manual handling activities are the minimum, or no manual. Sometimes we can completely avoid the manual handling task by just redesigning the workplace. How to redesign? It depends on the workplaces. See the activities and accordingly arrange or redesign so that we can avoid the manual handling activities. We can also use some mechanical aids like conveyor belt, forklift trucks, etc., which will avoid the manual handling activities. So in the control or the management of manual handling hazards, the first step is to avoid manual handling activities. Now coming to the second step, that is assess. We have seen methods to avoid manual handling, but in many situations it may not be possible to completely avoid manual handling. Then what to do? In such cases, we need to assess the risk of manual handling activity. Split the manual handling activity based on tile, that is task, individual, load, and environment. After splitting that activity into tile, assess each factor completely. A detailed risk assessment is needed only for high risk activities. How can we identify a low risk manual handling activity and high risk activity? This can be done by using tile. That is splitting the activity into task, individual, load, and environment, and assessing the risk. Apart from that, there are few guidelines which will help us to assess the risk. These guidelines indicate limits of load or postures for which the risk of injury is low. Let us see such few guidelines. First, we will see for the lifting activity. The figure shows the safe load which can be handled by a healthy individual at various height levels. In a lifting activity, this figure shows the safe load which can be handled by a healthy individual at various height levels. If the load in your workplace is less than the given value, the risk of injury is low. In such cases, no risk assessment is necessary. Written detailed risk assessment is not necessary. Only thing is that the activity has to be reviewed on a regular basis. With an example, suppose in a workplace, if a person moves a load at a height above the shoulder and away from the body, So as you can see from the figure, 5 kilogram is the safe load above shoulder, away from the body. If in your workplace, if the person is doing this activity and the load moved is 5 kilogram or less, then that activity can be categorized as a low risk category. Similarly, see each manual handling activity or lifting or carrying activity, you see at what height the load is being moved or carried, and see what load is being moved in your workplace. If it is equal to or less than the given value in the figure, then generally we can consider it as a low risk task. If hand enters more than one zone, then we have to take the smallest load in that area through which the hand is being moved. Please keep in mind that the loads have to be reduced for persons with special needs. All these loads are given for a healthy individual. Now, some manual handling activities require repetition. Then the loads have to be reduced if the activity is repetitive in nature as shown in the figure. These are just guidelines which you can just use to assess whether the manual handling activity belongs to high risk or low risk. Say for example here, say the second one, if an activity is being repeated 5 to 8 times per minute, the load has to be reduced to 50%. So in the previous figure, if you see in your workplace, say a person is handling, or a man is handling a load at a height above the shoulder close to the body, then 10 kilogram is the safe load. But if it is repeated 5 to 8 times, you have to reduce the load 50%. That means this 10 kilogram reduces to 5 kilogram if it is, the safe load reduces to 5 kilogram if it is being repeated 5 to 8 times a minute. So if the activity is repeated, then the given load reductions have to be applied while carrying the safe load, calculating the safe load. If it is pulling and pushing operations, pulling and pushing activities, these are the acceptable pulling and pushing postures. If the pulling and pushing activity is carried out in the given postures, then they may be categorized as a low risk activity. If any leaning, bending or stretching is there, then the risk of injury will be more, and it may be belonging to the high risk category. The distance to be moved also matters. If the distance to be moved is more than 20 meters, or if the floor is having tripping hazards, then in that case a detailed risk assessment is needed. These are the safe loads for handling while seated. If the load is more or it is handled outside the green zone, then detailed assessment is required. So see, in your workplace, if a person is handling a load while seating, see whether the loads are equal to the given value or the value shown in the figure, or it is lesser. If it is equal to or lesser than the given load, then it may be considered as a low risk activity. Next step in the management of manual handling hazard is reduce the risk. After assessing the risk reduction is to be done for high risk activities. Try to reduce the risk as far as practicably possible by engineering controls or administrative controls, or both. We'll discuss examples for engineering control first. Two cases have been shown. In the first case, a person is working at a height which causes some discomfort. In the second case, the worker has to bend and lift things whenever he required. As you can see in the figure, some slight modifications have been made to the work so that the person can work comfortably. In the first case, the height has been reduced to waist level, and in the second case, the basket has been lifted and tilted a bit so that the excessive bending can be avoided. So you can see it's only slight changes, but how the risk of the manual handling activity has reduced by these modifications. So these type of changes can be made in the workplace in order to reduce the risk. If any heavy or frequently used items are there, that may be kept at a height of say 0.5 to 1.5 meter from the ground, because the handling capacity is maximum and the load is just above the waist. Apart from engineering controls, you have to also use administrative controls. Administrative controls reduce the risk a lot, that is by good work practices, job rotation, stretch breaks, training, etc. The training of workers is very important in reducing the risk. Training should cover how to carry out the work safely, potential hazards, possible injuries or illnesses caused by the work, good work practices, PPE, injury and illness reporting system, etc. So we were discussing how to manage the manual handling hazards in workplace. We have seen that there are 4 steps: avoid, assess, reduce, and the fourth step is review. The risk assessment is to be reviewed on regular basis. Also, whenever there is any change in workplace conditions, that is any change in the task, individual, load, or the environment, the risk assessment need to be reviewed. Also, risk assessment needs to be reviewed followed by any injury or illness in the workplace. Another important aspect is medical surveillance. Medical surveillance is a systematic and continued medical examination of workers exposed to hazards. Pre-employment medical checkup is to be done for workers before they start the job. Then, periodical medical surveillance can be done in every 2 to 3 years. For manual handling activities, medical tests related to physical fitnesses and cardiovascular fitnesses can be done. Encourage workers to report any injury or illness related to work. This can be stressed during training sessions. Apart from these, symptom surveys and ergonomic surveys also help to identify the flaws in the system. These surveys can be done by distributing checklists to the workers, which they can fill anonymously. Checklists can include questions which indicate development of symptoms of injury or illness related to work, awkward postures, then excessive force needed for any task, fatigue, workload, etc. Keep the documents of all medical reports, injury illness reports, survey results, etc. An ergonomic trend analysis can be done once in a year, in which all these documents along with other documents like compensation claims or any accident reports, work complaints, etc. can be analyzed. This will help in identifying any previously unnoticed risk factors, or if there is any failure in engineering controls or administrative controls. Such activities can again be assessed, and then steps can be taken to reduce the associated risk. So friends, we have just had a brief discussion on how to manage manual handling hazards in workplaces. Thank you for listening. Bye.